we've got a few other topics to cover. In transitioning from pediatric to adult care, Trevor, what do you think are the important things that we have to do?
I think often when you are transitioning, it's usually when you've had a relationship with a family and been treating their epilepsy for a long period of time. And I think it's important to actually facilitate the connection with the transitioning physician. It's not just a matter of the data and the notes. It also relates to communication, family expectations, the patient's own specific situation. And it's really hard and time-consuming to get that data across. But I think to make the transition as seamless as possible, it's important to do that as much as you can.
Eric, what practice do you have?
It's very, very well. I think that the topic is challenging. If you go to our American Epilepsy Society, there's been lectures for the last 10 years about transition of care. And all the suggestions, they don't seem to have an impact. We still have a challenge. And if you ask pediatric neurologists, we tend to keep a lot of pediatric patients until adult life because we detect those patients that have a very difficult time transitioning. So one of the ideas that I had that I haven't implemented yet is the connector. So I think that it's very hard for a patient with a chronic illness with a lot of needs to lose their pediatrician and their pediatric neurologist. They're your family. So one of the ideas that I have is to try to involve the med speeds or the family doctors to be part of their medical care early in life. So instead of waiting until they're adults, maybe take over at age 15 when it's predicted that they're going to have a lung problem so that they can serve as liaisons with the adult neurologist. That's a project that I actually want to present to the AES, but that's because we need something that continues to hold the hands of these families that have a lot of needs.
Kate, what proportion of patients would you say that come to you graduating from the child neurologist to the adult actually have some sort of an organized transition plan in place?
Fortunately, that's actually changed substantially recently. I think for a few reasons. One, the electronic medical records are increasingly talking to each other, and so instead of 5 years ago when a very complex pediatric patient would show up for their new patient visit expecting me to have all their records which hadn't been faxed, hadn't been received, and I know nothing about them, now it's much more frequent that I can look up in our electronic medical record and see other providers' notes. Another reason is at Penn, a collaboration between one of our nurse practitioners and the Children's Hospital of Philadelphia, they've been working on a transitions program. And I think that has been really helpful. The key features of that program is that patients, when they're referred over for transition, our nurse practitioner is actually going into their chart before they come in, preparing for the office visit, messages the provider that's going to see them within the record. And we've established collaborators across all of the main comorbidity subtypes that patients need. Often they need a rheumatologist, they need a gastroenterologist, they need other types of specialties. And there are physicians that have interest in taking care of the kind of patients that we take care of within all of those fields, a dermatologist, et cetera. So the patients come and they are keyed in quickly to the other subspecialties. And then after the patient's initially seen by me or one of my colleagues, they automatically get a second follow-up with a nurse practitioner within a month to help smooth out that transition. I would say that it's really helpful if a patients are transitioned earlier in their adult years. One of the big reasons is that, at least in the region that I practice in, a lot of the services that they get from the governmental services they get as children go away when they become adults. And if we have a longer period of time to prepare for that, that is really helpful. So the worst scenario is they get transitioned later at the same time that all of that additional assistance is pulled as well.